I'm going to show you the simplest way to measure the GCS using my special mnemonics that really helped me during my neurology and neurosurgery rotation. What is the GCS and the easiest way to measure it? What are the limitations of the GCS and what other alternatives can be used when the GCS comes? Welcome to the medical mind, and let's look at the Glasgow Coma Scale together. The Glasgow Coma Scale is a neurological scale that is used to assess the level of consciousness in a person, especially after head injury. It was discovered in the year 1974 by two neurosurgeons, Brian Janet and Graham Tisdale. And now, don't you ever forget, we're going to mention the medical mind in no time. So there are three components we look at when determining the GCS of a patient: eye opening, verbal response, and motor response. And the maximum score for each is 4, 5, and 6 respectively. So to remember this, picture EVM 4, 5, 6. Let us take a look at the various components. For eye opening, you are to ask yourself, what causes the eye to open? And the mnemonic I always use is ESPN, a popular sports channel. So you are going to ask yourself, does the eye open spontaneously, or does it open in response to sound or speech? Or does it open in response to pain or pressure? Or there is no eye opening at all? So if the eye opens spontaneously, you score 4. In response to speech or sound, you score 3. Pain or pressure is 2. And if there is no eye opening at all, it is called 1. You will assess the verbal response by asking 3 questions to determine whether the patient is oriented to person, place, and time. Ask for his name, where he is currently, and which month or year he is in. With the verbal response, I always remember it using the mnemonic, my country win, with this picture of my country winning the Under-20 FIFA World Cup in the year 2009. So if patient answers all questions correctly, it means patient is oriented. If patient answers either of the questions wrongly, patient is confused. If patient says words that do not relate to the question, patient is giving inappropriate words. And if patient is responding with sound like ooh and ah, patient is giving incomprehensible sounds. And if there is no response at all, patient is giving no verbal response. So patient is awarded 5 for oriented, 4 for confused, 3 for inappropriate words, 2 for incomprehensible sounds, and 1 for no verbal response. So for motor response, I usually remember it using the mnemonic hold pen. O obeys command, localizes pain, draws away from pain, abnormal bending, abnormal extension, and no motor response. So to differentiate between the localizing of pain and draws away from pain, you apply pain at the supraorbital or the sternum. And when patient is able to move the hand towards that place, patient localizes pain. And when you press on the nail bed, and if patient moves away from the pain or the pressure you're applying, patient moves away from pain. So they are scored 6 for obeying command, 5, 4, 3, 2, 1 respectively. So record the score individually and totally. Example, E4, M4, V4 would be a GCS of 12 on 15. Here is a quick question, and let me know your answer in the comment section. Okay, so the GCS will be E4, M4, and V4. All those who get the answer, yay! The GCS is simple to assess and is able to predict the prognosis, but has the following limitations. Verbal response cannot be assessed in intubated patients. Eye opening cannot be assessed in patients with periorbital edema or patients who are blind. Brainstem reflexes are omitted. So alternatively, you can use the 4 score, which is the eye response, motor response, brainstem reflexes, and respiratory pattern, in especially cases where the GCS cannot be deduced. Thank you for watching this video, and don't forget to like and subscribe. See you in the next one.